I'm born and raised in East Tennessee. Went to ETSU in biology and got my master's degree in biomedical sciences there as well. Then I was lucky enough to go to Georgia to complete my medical school, and I pretty much knew from the start that I wanted to do medical oncology. I was diagnosed with a bone tumor in my spine in 5th grade and underwent radiation therapy as a kid for that, and then flash forward to medical school where my husband was diagnosed with melanoma. More recently, my mother-in-law has had metastatic breast cancer, and I truly feel like those have made me a better listener, a better doctor, a better person. I definitely want patients to know that I'm a real person, and I'm passionate about advocating for their care. My favorite part of being an oncologist is that relationship that you build with the patient. My passion for taking care of breast cancer patients has grown out of providing care to them. The landscape for breast cancer, from screening to treatment, has changed dramatically over the last 30 to 40 years, and I find that part exciting because it's provided more opportunities for treatment and for survival for patients. I want them to know that they're not a number, that we'll look at numbers and we'll talk about numbers, but they're not a number, that they're an individual, and that I want their care to feel individualized, because it is. We do strive to make sure that whatever specific needs or concerns that they have are addressed, and to just help them understand their diagnosis and what's going to happen. And sometimes breaking it down into a process can really allow them to feel more comfortable. I am grateful that Thompson has access to so many clinical trials. It's really unbelievable to see the progress that we've made in cancer therapies and treatments. I think particularly the last 10 or 11 years, we've really seen immunotherapy skyrocket, and that's had such a huge impact on overall survival. I'm a daughter, I'm a sister, I'm a mom, I'm a wife. My husband and son are, my best friends. They're who I hang out with outside of work. This is a photo block that has some dated photos of mostly my son, but my son and my husband and our dog Reagan. She's a rescue Shih Tzu. They're my hearts outside of clinic. They're my loves. Part of, I guess, just my own purpose is that I want to serve God first and community second, and those are core values that I share with Covenant and with Thompson, and so that was really important to me. Here at Thompson, all of the support staff, all of the providers genuinely care about what's going to happen for the patient. Thompson has really made strategic intent to develop that plan. It's not just throwing some things together. They really are striving to make sure that the patient's care is paramount. They come first, and the rest pretty much takes care of itself when a process is designed in that fashion. I would want a patient to come and see me and experience that. First, I'm going to listen to them. I'm going to treat them like a real person, and I'm going to have compassion with them. And the way that they meet me and know me the first day, that's never going to change. I'm still going to be that same physician who's going to take the time to answer their questions, whether that's, visit and treatment 1 or visit and treatment 20. I also want them to feel safe and comfortable, and for them to know that genuinely my goal for them to have a treatment approach that they feel comfortable with. It's not about me. I hope that's me, but if it's not, I want to get them where they need to be that's going to work best for them.